and also on our Terp Family YouTube channel. This session is being recorded, so if you have a family member or a friend who's unable to join us this evening, they can view the recording, which will be posted on the Terp Family YouTube page tomorrow. The Terp Family Chat Series is sponsored by the Office of Parent and Family Affairs. So if you've not attended an orientation session and you're unfamiliar with the office, I want to make sure that you know that the Office of Parent and Family Affairs serves as a single point of contact at the university for parents and family members of all of our undergraduate students. Please consider them your home at the university. The goal of Parent and Family Affairs is to educate and engage all of you in becoming informed and involved partners in your undergraduate students' education, in their personal development, and of course, in their success. Terp Family Chat is our special summer online series, and it's designed to provide updates, timely information to help you and your family prepare for the fall semester. We really do recognize how difficult the past 16 plus months have been and the ways in which overlapping pandemics have affected the university, community, and the world. So we'll share important details on a variety of topics related to student success and support this evening. And the focus of tonight's session is #VaxForMaryland. So you'll get an opportunity to hear from several of our leaders in the Division of Student Affairs. They will review the University System of Maryland COVID-19 vaccine requirement, the university's exemption process. They will share with you some important deadlines for your students. We'll also talk about quarantine and isolation housing and the testing and masking plan for unvaccinated students, as well as faculty and staff. Each of our speakers will share or review information with you. So for our remaining time together, we will spend answering questions many of you have already submitted when you registered to attend the session. So I am pleased to introduce our very first speaker, Dr. Patty Perillo, who is our Vice President for Student Affairs. And Patty, I will turn it over to you.
Welcome, Terp family. We are really, really glad that you were here. I certainly am. I started in this role as Vice President for Student Affairs last January, just about 7 weeks before we moved moved everybody off campus. And so most of my time has been in the middle of the pandemic and helping to lead campus efforts. What I do know is whether you are sending your first child, your middle child, your only child, or your last child, we know that this is a family affair. And whether it's a returning student or a new student, what we know is that the lives of our students are so connected to the lives of their parents and families. And that is why we want to be in relationship and partnership with you. You really do matter to us. And what we know is that our relationship will make a difference in the success of our students. And that is exactly why we're here. The Division of Student Affairs is here for one primary reason: to make sure that our students are successful. And what we know is that part of that formula is to make sure that you are a part of that connection. So really want to say a hearty welcome to the Terp family. You are Terps too, parents and family members. We don't just say that for our students. We think that you're a part of the Terp family too, so welcome. As you all know, and it's likely why you are here, is that several months ago, the Chancellor, in the state of Maryland system, we call it the University System of Maryland, USM, who was a medical doctor. And I think that it's been very fortuitous in many, many ways that as we are in the middle of a pandemic, a new chancellor has started just a couple months before the pandemic hit, and he is a medical doctor. And so he knows a lot about public health, and he knows a lot about medical health. And we have a hospital in the Maryland system, right? The University of Maryland Hospital is a part of our University System of Maryland schools. And so we also have, even at the University of Maryland, an exceptional school of public health. I happen to be a graduate of that program, so I'm an alum of the University's Maryland doctoral program in public health. So we have an exceptional public health program here on our own campus. And so with the best medical expertise, with the best scientific review, guided by public health and medical experts, all the presidents in the system, and there are 12 schools in the system of Maryland, with the chancellor, made the decision that it would be a requirement for all students, faculty, and staff that would be attending a University of Maryland institution to be vaccinated. It is a mandate. And we take the responsibility, whether we're in the middle of a pandemic or not. The truth of the matter is, one of our fundamental priorities as an institution of higher learning is to make sure that each and every one of our community members is healthy, well, and safe. And certainly that applies to in the middle of a pandemic. And so the mandate for a vaccine is about doing all that we can, taking our leadership very responsibly, and making sure that we're doing all that we can to make sure that every member is as safe as possible. And my colleague, Dr. Marinopoulos, who Andrea will introduce in just a moment, will tell you a little bit more about the process of exemptions and some of our protocols. And we are very lucky to have him on our campus as well. So again, thanks for being here. I'm glad that you are here, and I hope that we answer the questions that you have.
Thank you so much, Patty. We appreciate your words this evening. Our next speaker is Dr. Spiro Marinopoulos. Dr. Marinopoulos is the director of the University Health Center, and he's also our chief medical officer for the University of Maryland. Dr. Marinopoulos joined us just this past year in January, and boy, did he hit the ground running. He is a wealth of knowledge, and we're so glad that he's here. Dr. Marinopoulos.
Thank you, Andrea. Thank you, Patty. It's great to be here with all of you. I wanted to talk a little bit about our vaccination timeline first. So we are requesting all of our students who are returning and our incoming students to complete their vaccine by August 2nd. That is the date that we would like everyone to receive either their only dose of the Johnson & Johnson vaccine or their second dose of their Pfizer or the Moderna vaccine. So this will allow everyone to be fully vaccinated by August 16. We define fully vaccinated as having completed your vaccine dose plus 14 days from that. So that's how we come up with the August 2nd date and the August 16 date. This will allow everyone to be protected against COVID by the time the campus returns, students move into residence hall, staff return, etc. We realize that some students may not be able to be vaccinated for medical or religious reasons. And if that is the case, we have available a process for those students to apply to be granted an exemption. The medical exemption refers to students who may have a severe allergic reaction to a component of the COVID vaccine or the vaccine itself, or to students who have a medical condition that is serious enough that they cannot receive the vaccine. We would request their physician to provide a statement providing medical information that would then be reviewed by our the health center, healthcare providers, and then we would grant this exemption if warranted. The religious exemption is related to having strongly held beliefs that might prevent our students from receiving the vaccine. And that is a process that's handled through a different office in University Human Resources. So those forms are available to you if you would like to request an exemption. Those students who are vaccinated by the deadline will be able to join us in the fall and will not be required to mask or to be tested when returning to campus. Those students who have been granted exemptions and are not able to be vaccinated will be tested frequently and will have to wear a mask. So those are two main distinctions between those groups, but all will be allowed to join us on campus. So these are the items that I had to cover at this stage. I'll be happy to answer more questions when we get to the Q&A.
Thank you so much, Dr. Marinopoulos. We appreciate all of your knowledge and thank you for answering all the questions that I've had this year for you. We appreciate it. Our next speaker is Tom Flynn, and Tom is the Director of Conference and Visitor Services. And Tom is going to share with us a bit about quarantine and isolation housing and also student compliance related to our COVID expectations. Tom, take it away.
Thank you very much, Andrea. Good evening, everyone. So I'm here first to talk about quarantine and isolation housing. We are going to continue the program that we had last year. So if you're a returning student, you probably heard about it. But if you're coming to us for the first time, the program is open to residential students, students who live on campus. And the students who get placed in QI housing are those who are not vaccinated, and Spiro can help me out if I make a mistake. They're not vaccinated, but they've had close contact with someone who has been tested positive. So they go into quarantine. And then if you have tested positive for the virus, then you go into isolation housing. So those are the two categories of students that get served by the quarantine and isolation program. When you get referred to the QI program, as we call it, you will be assigned a case manager who will help you walk through all the steps to get you situated into QI housing. And they will stay in touch with you throughout the entire process. So you will not just be sent somewhere and left by yourself. Our quarantine and isolation housing, you'll either be housed in an apartment or in a chapter house, which is traditional style housing, depending on your diagnosis and the availability of housing. And meal service will be provided if you are on the meal plan, then that's included in your meal plan. If you are not on a meal plan, there will be a charge for that. So that's quarantine housing in a nutshell. And so we'll continue it for the fall. And then compliance. So as Spiro mentioned, August 2nd is the deadline to be vaccinated, to be considered to be in compliance. You will be considered fully vaccinated 2 weeks after that. So that is the date to remember when you're thinking about everything you need to do to prepare to come to Maryland. So we are still discussing some of the compliance possibilities, but the courses will lead to a registration hold where you will not be able to change any of your classes or your class schedule, all the way to canceling your registration. This is something we don't want to do. That's a last resort, but this is important to the university. And so this is what is in discussion now. That's the vaccination. As Spiro mentioned too, people who are not vaccinated, who are exempted, there is a testing requirement for them. And that we will be tracking testing. And you can do that through a website, return.umd.edu. And making sure that students remain in compliance with their testing requirements. It will lead to the same things, registration holds, or cancellation of your registration if you do not continue to remain in compliance. And I suggest we have a testing program on campus, and administratively, if you participate in that testing program, that's the easiest way to help you do everything that you need to do. So those are the two areas I was asked to speak about.
Thank you so much, Tom. So much good information there. We appreciate it. And our final speaker this evening is Michael Glowacki. Mike is the Chief of Staff in the Department of Resident Life. And Mike is going to share some information with us that is specific to residential students. Thank you, Mike.
Thanks, Andrea. Hi, Terp parents. So glad that you're with us tonight. So glad that your sons and daughters are going to join our unique community in the residence halls this fall. Our residence halls exist to support the academic success of our students and to provide them with opportunities for engagement and learning outside of the classroom. And boy, we are so happy to have students come back in droves to our halls this fall. Really, one of the greatest things about the vaccination requirement, one of the most positive things in my mind as a housing person, is it allows us to return to a vibrant, engaging residence hall experience. This last year, out of necessity, our housing program had to be built around pandemic mitigation as the highest priority. The health and the safety of those students who lived with us was really the top thing that we had to be concerned with. We had students in all single rooms, so students didn't have roommates. We had a very severely limited visitation policy to help maintain social distancing. Our dining program for much of the year was built around a concept of grab and go. And so we didn't have large groups of students gathered in the dining hall, sharing a meal, sharing their stories of the day. We spent so much time talking with our students and informing them about enhanced health precautions and looking out for clusters and outbreaks on our residence hall floors, and everything appropriately and necessarily had to be built around those health and safety practices. This year, it's going to be very, very different. Everybody's going to have a roommate. Students will be in class in person. They'll be in study groups. They'll be engaged in student activities all over campus. And they will be engaged in one of the great traditions of residence hall living, which are late night conversations about love and life and fortune and everything that you can imagine under the sun. And we just can't wait for that to happen. Invariably, in almost all cases, when I have an opportunity to speak to parents at move-in throughout the year, I talk to hundreds of parents on the phone and answer questions and help solve problems. But almost invariably, our conversations turn to our experience as a college student, what it was like to have those experiences, the friendships that have lasted a lifetime. And what our staff are doing right now is preparing to help your sons and daughters to have that experience. If you can hear some screaming, I'm in a house with a very large family right now, and I apologize for that. Everybody was supposed to be out getting pizza tonight, and that didn't work out. So my apologies for that noise. It's a joyous, joyous noise, though.
Mike, we just thought that you were giving parents and families an idea of what it's like to live in the residence halls. Lots of energy and excitement.
Yes. Hopefully not that much screaming, but who knows? Depends on the day. So really, when we talk about expectations, the primary one is this vaccination requirement, and so that's the most important one. Students will not be permitted to even check into the residence hall until they are in compliance with that requirement, either through the vaccination or an approved medical or religious exemption. But once students do that, what we hope is the conversation moves about expectations moves from masking and distancing and testing to really expectations about what does it mean to be a good citizen and what does it mean to be a leader in this community, and how can you help each other support the scholarship that goes on here. And rather than social distancing, it's about social engagement. And so we are just thrilled and excited. If I could if you'll indulge me for just a minute, a couple of practical things that aren't entirely related to vaccination, but I know a lot of folks have questions about. You will be notified of a room assignment and roommate information on July 14th. So we're about 2 weeks away from that. We encourage you to talk with your students, to talk with their roommates over practical things and less practical things. And then you'll want to start thinking soon about move-in. We offer 2 options for move-in. One is a set up and go option where you can come about a week and a half before classes start. The student doesn't stay overnight, but it leaves the family a nice opportunity to move their belongings in early. It'll all be by appointment. And I encourage anybody who has the wherewithal and lives close enough to do that. Those appointments will be available August 18th through the 21st. And we will also offer more traditional move-ins August 26th through 29th, right before classes start. All of this information is and will be on our website. There'll be additional Terp family chats throughout the summer that you can sign up for, that myself and my colleagues will attend and talk in more practical about the more practical parts of that move-in. But please know that we are excited for this year in a way that in 32 years of this work on campus, I haven't been excited, and you and your families are a large part of that. I've sent 3 boys off to college. This is your first time sending a child to college. Know that there will be tears, but there will also be great pride and great joy in the experience. So thank you for being with us tonight. And I turn things back over to Andrea.
Mike, thank you so much. We appreciate all your knowledge about living in the residence halls, and we especially appreciate the background noise because that gives us a little inkling of excitement for the fall. At least it does for me. I'm excited to have our students back with us on campus. So thank you to all of our speakers this evening. We are going to now move to the question and answer portion of the Terp Family Chat. So I have a few questions that I'll pose to our panelists, and these were the questions that were submitted by many of you when you first registered to attend tonight's session. So my first question is going to go to Dr. Marinopoulos, I believe. And Dr. Marinopoulos, can you tell us what is required for proof of vaccination?
Sure. Thank you, Andres. That's a great question. So if you have been vaccinated, all you have to do is upload a picture of your vaccination card or of your record of vaccination on our website, and we will take it from there. We will review that information, and then we will mark you as compliant. If you are a returning student, and you have been vaccinated in Maryland, we may be able to access that vaccination record through our system. We have an interface between our electronic medical record and the state of Maryland vaccination database. So you may already have been marked as compliant. And that's really all you have to do. It's a relatively simple process.
Perfect. Thank you for that. So this question goes along with that. What about for students who want an exemption? Who's eligible for an exemption and who decides or approves the requests? And what kind of exemptions are we granting?
Thank you, Andrea. As I alluded to earlier, there are 2 types of exemptions. One is called a medical exemption, which refers to having a medical condition that might prevent you from receiving the vaccine. That includes having a condition that might prevent you from receiving a vaccine or having a severe allergic reaction to a component of the vaccine. That would apply to cases where you may have received the first dose of your vaccine and you had a severe reaction. So that is the medical exemption. These are submitted to and reviewed by licensed healthcare professionals in our health center, and ultimately by myself as well. And then the second type of exemption is called the religious exemption, which has to do in cases where your religious beliefs strongly held religious beliefs might prevent you from getting vaccinated. And you would also submit, there's a form for that, you would submit that and that would be reviewed by the office that reviews those requests as well. We try to get back to students, families within 48 hours of receiving a request. We will either grant the exemption, and I'm speaking of the medical exemptions of which the health center is responsible, or we might request more information if we don't have sufficient information to either grant the exemption or reject the exemption. Those are the 2 most common outcomes that we have seen so far.
I would say that I just want to add to that, Spiro, that for the religious exemption, there's a panel of colleagues from several different divisions on campus. So there's a rep from student affairs, academic affairs, HR, and some other areas that are convening to look at the request for religious exemptions. So the health center manages all the medical exemptions, and then there's a team of colleagues that look at the religious exemptions.
Absolutely. Thank you, Patty.
Patty, I'm going to give this next question to you. At the beginning of our conversation, you started out by talking a little bit about the University System of Maryland and that we're legally or that we're able to require the vaccine through the system. So can you share with us, how is the University System of Maryland legally able to require the vaccination for all of our students?
My guess is that the answer to that question is best answered, if you will, by our legal counsel office, but I will provide a response that I've heard them talk about. So the decision for something like this, as you can only imagine, was not something that was done lightly or easily or quickly. There were iterative, ongoing conversations and consultation with legal counsel. So the system has its own office of legal counsel, just like every university has its own office of legal counsel. And so this decision was done in partnership and guidance, I should say, in guidance with legal counsel. The system, the chancellor, has the authority and responsibility to make sure that he or she, depending on who is the chancellor, makes sure that members of every campus that they have responsibility before is healthy and safe. So the authority of that responsibility for safety, both physical safety, psychological safety, is with the chancellor of the system. So the chancellor of the system has the authority to make such decisions. And he decided, in conversation with other presidents, other medical doctors, public health faculty members, and others, he decided to make this decision and got legal guidance to allow for that to happen.
Thank you, Patty. We appreciate your response. Next question. What's the protocol if a vaccinated student tests positive for COVID-19?
Thank you, Andrea. I'll take that.
Okay.
Any student who tests positive for COVID-19, whether vaccinated or unvaccinated, would self-isolate. So there will be isolation housing that Tom talked about, and the student would remain in that housing for approximately 10 days. We would want a student who tests positive to contact the health center for medical advice as to how to take care of them, should they have any symptoms or should they feel unwell. And we have a team of healthcare professionals that support that and are there for all of our students who are in need.
Terrific.
And just a point of reference too, because people ask this question, if you test positive, you do not have to go to QI housing. You are welcome to go home. So that is an option to you.
Great, thanks, Tom. Thank you, Spiro. So Tom, is there any routine testing that's going to be required for students who are fully vaccinated?
As far as I understand, no. If you're fully vaccinated, if no routine testing, if you exhibit symptoms, well, you'll be asked to go to the health center and get tested there.
Let's break that down a little bit. So we will not be doing routine testing for people who are vaccinated. Those who are unvaccinated will be required to be tested twice a week, right? So that is kind of standard. And there may be times that we will do what we call surveillance testing. So there may be times that we decide to bring, a couple floors of a certain residence halls, or a particular athletic team, or a particular fraternity or sorority, or a research lab. And that would be done under the guidance and director of our chief medical officer, Dr. Marinopoulos, who's on this call. So if he is feeling like, you all know this, we're dealing with the Delta variant, right? We don't know yet what that's going to bring to our campus in a couple of months. We're just beginning to hear more and more and more about that. And as we continue to learn more, as people move back to campus, as we continue to learn more, we're constantly paying attention. We're taking in lots of data and information. We have lots of systems where we're capturing lots of information. If Dr. Marinopoulos thinks that it would be prudent for us to just bring in a group of students or faculty and staff to test, then we would do that, but it wouldn't be in a routine kind of way. Dr. Marinopoulos, do you want to expand on that a little bit?
That's a perfect way of putting it, Patty. And I think it's important to make the point that the situation is fluid, given what we've learned about the virus, what we're learning about the virus, the new variants, the new Delta variant. So what the information we're giving you today may be different from the information we give you on our next chat, right? Or at the time that students are moving in. But for now, we are not planning to be testing any fully vaccinated students. We will be testing students who are unvaccinated, as Patty has suggested. And that is our plan. But this may change as we obtain more information and as we get closer to fall.
Dr. Marinopoulos, I'm going to ask you this question as well. Do fully vaccinated students need to wear masks? So are there any mask requirements, for example, in classrooms, especially like large lecture halls? And what about students that are not vaccinated?
Great question, Andrea. Thank you. So I'll start with the easy answer, right? With regard to the students who are not fully vaccinated, they're exempt. They would need to mask in all indoor settings and in outdoor crowded settings. With regard to students who are fully vaccinated, currently there is no requirement for masking, with a few exceptions. These exceptions include certain indoor crowded spaces, etc. However, this is a fluid situation, and we will know more about this before classes start as we learn more about the virus, the new variants, etc. So the only thing I can say for certain is at the moment, we know for sure that if you're unvaccinated, you would need to wear a mask. That would be a requirement. If you're fully vaccinated, you may or may not need to, and we will be assessing the data as we collect it and as we approach August.
Great.
And I also want to remind everybody that the expectations that we're talking about are, for students, and we're telling you that as parents and family members, but the same expectations are also for faculty and staff.
That's right. That's another key point is we are a community, and students, faculty, and staff are part of that community. So all expectations apply to all.
Wonderful. Thank you so much. I'm going to ask Mike to answer our next question. And Mike, can you please tell us what systems are in place to increase air quality, especially in the residence halls?
Thanks, Andrea. Caring for our facilities is one of the signature enterprises of residence hall management. We're fortunate that we have an entire department of professionals dedicated to the residence halls. So separate and apart from the facilities management unit that oversees maintenance and housekeeping and design and construction in all the academic buildings, the Department of Residential Facilities is dedicated to specifically the residence halls. So we have our own teams of engineers, architects, maintenance professionals. All of our buildings currently meet or exceed both regulatory and industry standards for air quality and circulation. There's a range of HVAC and air handling systems across the residence halls. I'm not an expert in them, but fortunately we do have experts, and that team is constantly doing both preventative maintenance, reactive maintenance, monitoring of air quality. And so I think folks can feel quite confident in that group that if any sort of problem arises, you've got people on your side who can respond to whatever concerns you have.
Great. Thank you, Mike. And I believe what is our last question is related to international students. And I think Dr. Marinopoulos, this is probably for you, but can you generally address what are the requirements for international students, particularly related to the vaccine?
Of course, thank you, Andrea. So international students will also need to be vaccinated. Now, we have 3 vaccines available in the United States that are FDA approved, and there are vaccines that are available internationally that are not available in the US, but they are approved by the World Health Organization. So for international students, our requirement is that they receive a vaccine that has been authorized by the World Health Organization. And if they do, we will consider them to be fully vaccinated. Of course, this will depend on the timing of vaccine administration. Are they going to be able to receive it? If they're not, we will actually be able to provide a vaccine to them as soon as they arrive in the United States. If an international student receives the vaccine that's not authorized by the World Health Organization, we will make a determination when they submit that information as to whether that vaccine can be accepted as well. But we reserve the right to revaccinate them once they arrive to College Park.
Andrea, the thing that I want to add, thanks, Dr. Marinopoulos. The thing that I want to add is that we are doing our due diligence and our best to communicate all of these expectations to our community. So you as parents and families may be receiving the community messages if you've signed up with our Office of Parent Family Affairs to receive such messages. And if you haven't, I really encourage you to do so. But what happens is on almost a weekly basis or every 8 days, there's a letter coming out from Dr. Marinopoulos or Dr. Marinopoulos and me, or the president and the provost, or the president and Dr. Marinopoulos. We continue to share the expectations. We are also now doing what we're calling targeted communications. And so we are actively communicating with our international students. So we're sending very specific and direct messages to our international students. Resident Life is doing the same thing with all of the students that are living in the residence hall. So they're having communications and interactions with people who are living in the residence halls. And so the things that we are sharing with you are the kinds of messages that we have been getting out for weeks, if not months now, and we will continue to do targeted messaging to the communities that need such messages.
Thank you, Patty. Appreciate that. I lied. There's one more question for Mike. Mike, are there any extra precautions students living in the residence halls should consider or prepare for?
I don't know that there are extra cautions necessarily. Certainly, I think we've all learned from this last year and a half. Like I went 15 months and didn't get so much as a common cold from wearing a mask. I'm not suggesting that everybody wears masks, but I think there's been a readjustment of our understanding of personal space and how germs spread. And so as we welcome vaccinated students into the residence halls, we want them always to follow the advice and guidance, and that can evolve, as we've talked about here, from our healthcare professionals on campus, the public health folks. But we also want students to kind of engage in their lives in the residence halls. And one of the most important things we've learned over the course of the last year is if you're sick, stay home from work, stay home from class. And we're hoping that's a habit that sticks with folks. For so long, it seems like there was this culture of I'm going to stick it out and I'm going to tough it out and I'm going to show up. And all I do is I get other folks sick by doing that. So I think if we all engage in some common sense, learn the lessons that we've been able to learn over the course of the last year, we will have a great year together in the residence halls.
Mike, I don't know if you've witnessed, but Dr. Marinopoulos was smiling because I think that's every medical doctor's dream, that people pick up healthy habits that stay, with them. Was I reading that right, Spiro?
Yes. Washing our hands, covering our mouth, right, or cough, which is really wearing a mask, right? We're wearing a mask, we're covering our cough. All of those good habits when we're not feeling well are things that we've learned this past year. So absolutely a great lesson. And as we all know, we've had almost no cases of the flu this past year because of that. Minimal cases of colds and upper respiratory ailments. So that's one of the silver linings, I think, one of the things that we've learned. So great point.
Absolutely. And speaking of masks, I do just want to underscore that while unvaccinated students, faculty, and staff must wear masks inside, there are many who are vaccinated that are still going to choose to do that, right? So that I just want you all to know that in this community, we're going to have many people wearing masks, some who are vaccinated and some who are not, because for some who are vaccinated, for the reasons we just talked about, they may just feel like they want to avoid the cold or the flu or something else, or perhaps they're concerned about the variant, or perhaps they have allergies. There's all kinds of reasons, but just because one doesn't have to wear it doesn't mean that there won't be folks who do wear it. So I just want to normalize that, because I think it's really important to do so.
Thank you so much, Patty. Appreciate it. So thank you to everyone who submitted questions. We realize that maybe you didn't get a chance to ask any questions that you have. So at this time, we're going to provide you with a couple of websites and some information where you can submit your questions regarding the vaccination requirement, regarding exemptions, or even compliance questions. So if you have those questions, you could email healthconcerns@umd.edu. And then, of course, if you have any general questions, please feel free to contact us at the Office of Parent and Family Affairs at terpfamily@umd.edu. So that formally ends our Terp Family Chat for tonight. I want to thank everybody for joining us this evening, and I want to give a special thanks to my wonderful colleagues for the information that they shared with us and for answering all of our questions. So, you know, our next Terp Family Chat is scheduled for July 14th at 7 o'clock. So we hope that you can join us then, and we hope that you all have a wonderful evening. Thank you so much for joining us. Welcome to all of our new Terps, and welcome back to our returning Terps.